Professor Lulu Bravo from the University of the Philippines, and I am really happy and honored to be part of this ASEAN to World Dengue Day. Ladies and gentlemen, this is the last session. For the past 3 days, you have been involved in so much information about dengue. I think, every day we had about 8 hours of banter. We have had 8 hours of conversation. We have 8 hours of conversation and discussion. And wow, I can really imagine that by now you must be exhausted, right? But no, because I know most of you who are still here are still thinking, there's still one more thing that we are going to talk about. And that is how we will tell the world that dengue is a global threat, that it's not just ASEAN now, but actually a world dengue. And this is just about the things that we are going to talk about. 2011, when the first ASEAN Day was actually established and was hosted by every ASEAN country. There are 10 ASEAN countries. And if I can name them, Philippines, Malaysia, Singapore, Brunei, Cambodia, Laos, Thailand, Vietnam. Did I miss anyone? 10 ASEAN countries. And they all share a common tropical country, and that definitely dengue. Now I have here a panel, including that of Dr. Kamran just about 2 hours ago. I know he has been very, very much involved in the International Society of Neglected Tropical Diseases. But other than that, we do have a lot of tropical diseases also that somehow it seems like dengue is still the number one, right? And here we have wonderful speakers, very distinguished, and definitely people who are here have experienced dengue as it is in the real world. Because definitely the Philippines has been suffering from dengue for the last 70 years since its first discovery in 1954. For the last 70 years, the Philippines have been battling dengue. And truth to tell, my goodness, we have not really decreased the incidence of dengue. In fact, for the last 7 years, it's been like a roller coaster ride with a peak becoming higher and higher every 10 years. So, here to talk about what we have gone through in the last, how many? Not 70 years maybe, but at least in the last 10, 12 years that dengue has been devastating the ASEAN region. Here to talk to us about that is one of the best communicator in the Department of Health of the Philippines. And she is head of the Health Promotion Bureau. She's very good at imparting response teams. Right now, she's involved in COVID, but I'm sure she has so many things to tell you about dengue. She is head, as I said, of the, not just the Health Promotion Bureau, but the a part of the Prevention and Control Bureau of the Department of Health. She's so young, but she has been so much experienced. Ladies and gentlemen, please welcome no less than Dr. Beverly Lorraine Ho, and she will share with you the lessons learned and all the things that may be important for the world to know what dengue is all about. Please, Dr. Beverly Ho, take it away.
Thank you very much, Professor Lulu. Of course, Ma'am Lulu shaped a lot of the health professionals in the country, and I'm happy to be one of her students. So just to share with you, this presentation sort of perhaps crystallizes some of the key lessons that we've learned in the Philippines, which has been um, declared no, by Ma'am Lulu a while ago. We in the ASEAN region face similar challenges in terms of our combating of the dengue issue. So here you'd see cases no, among the ASEAN countries, and there on top of it all, you'll see the Philippines really having one of still the highest burden of dengue cases among ASEAN countries. And while the numbers have converged a little bit last year in 2020 when we all undertook the pandemic, we still don't know what it's gonna look like, and we don't want the roller coaster to happen again. No, we actually want this issue controlled as much as we can. And so many challenges face all of us as implementers, as clinicians, as public health managers. But what did work, at least for the Philippines? No? So we post three um, good practices that have been able to help us manage this. So, over the course of the last 3 years, 2018 to 2020, 2021 numbers are still only until April, we see the roller coaster that Professor Lulu was talking about. It was pretty good in 2018, then you'll see it goes up again in 2019, and the pandemic has brought the numbers down in 2020. And hopefully by 2021, we are continuously able to control the situation. But nevertheless, the numbers around case fatality rate have been pretty stable in the country, and we're at below 1%, no, which is good. Our mortality also seesawing, but pretty much more consistent than our morbidity rate. So with this, what does this tell us? No? What have worked in the last 10, 15 years? First lesson is around health promotion and disease prevention. The Philippines is, as you all know, is a devolved governance setup, which means that the national government agency, us, the DOH, is only able to put out standards, overall national strategy, but this is really being implemented by 1,500 different municipalities and 81 provinces. All of them would have varying resources, health human resources, budget, and even political will, no, or ownership of this situation. So over the last 10 years, with the help of many of our physician groups and healthcare professional organizations and some civil society groups, capacities have been slowly built in different local government units and the communities so that this can actually happen when it needs to happen. No? So LGUs or local government unit and communities serve as the backbone of our dengue response at the end of the day. We can't do it on behalf of the households and the communities. So the key strategies being implemented, and I'll show you photos in a while, are really a 4 o'clock habit, what we call, and the enhanced 4S strategy and the action barangay contra dengue. Barangay is sort of like our smallest unit of governance or the village. No? In relation to this would be risk communication. So this is being done both using above the line communication, that would be television commercials, radio commercials or reminders, public health, public service announcements, but as well at the local level. So you will see here in the photos, the coordination and planning has to be done at the local government unit level. After all the resources are with them, the entire health unit at their level reports to the local chief executive, no, not to the Department of Health. What they rely on from the DOH are really the guidelines, no, on how to do certain things, what to buy, etc. But really, the work is with the local chief executives. Then The next part would be community engagement. Sometimes we would be able to engage volunteer health workers. At times, it will really be third party, private sector who actually donate for purposes of their CSR responsibilities. At other times, it would be development partners. Though. But in general, there are various forms of community engagement depending if it's rural or urban. Intersectoral collaboration is something that all of us are pretty familiar with. And here you see that it's not only happening in the communities, but also in schools. Though. Um, then our 4S strategy, as what has been mentioned a while ago, is as follows. No? The search and destroy mosquito breeding sites, seek early consultation for those who've had symptoms, self-protection measure, and support fogging or spraying, particularly in hotspot area. Here you see the 4 o'clock habit when it was launched and being done regularly now. The LGUs themselves or local government health workers themselves would activate these search and destroy mosquito breeding sites at a particular time during the day. In the same way, no, these are more photos of destroying the mosquito breeding sites and supporting fogging and misting activities because this will require more resources. Then this would really go up to decision making by the local chief executives. Vector surveillance is also being undertaken all as part of community-related activities. So this one, the lady on the left-hand side, this is particularly new, quite recent because she's wearing a shirt because she's also a volunteer for the vaccination program. No? So the same health workers are undertaking these challenging initiatives. So we've also had a lot of media engagement. As you see here on the top left-hand side, this is actually the Secretary of our National Defense, no? So he's a general. But this is also the way we engage some of the other agencies, and it's not just the DOH or the Secretary of Health who's seated there in the middle, but even other sectors, no? As much as possible, how can we engage them because we need them to champion this initiative. So a lot more campaigns that are being done targeting various socio-economic segments, and even the designs of our materials would reflect that. No? So some of these are also being done by the LGUs themselves. So even like an MTV here. No? So I won't go through it, but really, okay. Next slide. So the second key lesson that the Philippines would like to offer the region and the world would be the importance of surveillance. Perhaps for pretty much established healthcare systems, this is a given. No? But in particular for the Philippines, surveillance has always been a challenge. Again, why? No? Because surveillance is largely dependent on good data and on people, right? And again, because of a devolved system that we have, surveillance has been a challenge, no? Who undertakes it, etc. However, for dengue, we have been pretty successful in terms of establishing a good system for this, such that on a week-to-week basis, we're really able to keep track of cases. No? So we do get regular reports around this after the disease really gained prominence perhaps 5 to 6 years ago. So with this, we're pretty proud of a good level of active surveillance. So it allows implementers to foresee possible outbreaks and really be able to localize and target the resources, the limited resources that we may be able to assist our local government units with. You know, so surveillance also allows us to analyze and track our trends and really be able to, as mentioned, target our support. So laboratory strengthening is also very much related to active surveillance. So with this, we have started also supporting our local government units by buying the test kits. No? And then the final lesson that we hope to share to the world is we recognize that because of this roller coaster experience with dengue, we will continuously need new technologies. And the experiences of the Philippines has led to the institutionalization, finally, no, of the health technology assessment process, which in the past has always been there to a certain extent for our national formulary, but never really institutionalized. I think moving forward, we anticipate that there will be more and more technologies that will be employed in order for us to really truly stamp out and control the dengue issue, no, in our region, and perhaps the rest of the world who's also suffering from large cases of dengue. And for this, the health technology assessment process is now institutionalized in the country. We've used it for the last year for a lot of the interventions being introduced for COVID. And this is something that we're pretty proud of in the way that it is able to protect the integrity of the system also from political influences. No? Now there's really a mechanism for good technologies to be able to pass a certain level of scrutiny with utmost fairness. So overall, from the Philippines, I think these are the three lessons that we might be able to bring to the world as we scale up work on dengue and work towards making sure that we will be able to manage this scourge amongst our people in a more systematic and more strategic manner. So, with that, thank you very much for this opportunity to share our lessons to all of you. Back to you, Professor Lulu.